Hi everyone, it looks like we're live. We'll wait for 15 people once again to join the stream before we officially begin. I hope that if you're watching today's stream, you're sharing today's stream right now to your friends, to your family, to people who will benefit from today's Facebook live stream because we have a very an expert in the field today who is with me. He's also my main consulting doctor. So I would like to encourage you, if you're watching this, please share this stream with your friends, with your family, raise awareness, find out how to maintain a healthy gut, and also more about gastrointestinal cancers, which actually ranges from our esophagus all the way to our rectum. And there's a lot of parts of our gastrointestinal tract, which actually I found out after I read more about it. I keep thinking it was the colon, the rectum, but it is definitely more than that. So remember, please share this with someone who will benefit from this, or just share this with your friends and family. We need to raise awareness. I know that a lot of people are out right now because everything is back open, but I really hope that you guys can join in because will be very informative. It looks like we have 15 people already, so welcome to Talking Live with Macy. Thank you so much for joining us on your Sunday. And like I mentioned, it looks like everyone's out and about. So please stay safe. There's still COVID-19 around. So practice the SOPs. Well, today is the second episode of a three-part series on colorectal cancer awareness, which I'm doing on Talking Live with Macy. And today I'm so excited to have my main doctor and consulting surgeon here. Before that, I think you all should know what today's topic is, which is on gastrointestinal cancers. Like I said, it ranges from our esophagus all the way to our rectum and also includes our liver, our pancreas, our stomach, and our colon. So there's so many parts to our gastrointestinal tract. And colorectal cancer itself, which is a part of it, is actually the main cancer amongst males in Malaysia and the second most common cancer amongst females in Malaysia. So if you're watching this and you know people who have had gastrointestinal cancers or want to find out more about it, please do share this with them. And today I have someone that, like I said, he is my main consulting doctor. He's a gastrointestinal surgeon and specializes in laparoscopy. He is Datuk Dr. Yunus Gul from Prince Court Medical Center. So I'm so happy to have him on. Thank you so much, Datuk Dr. Yunus, for joining us. And thank you, Prince Court Medical Center, for arranging today's session. So I think for all of you who have questions, it's best that you start asking them now so we don't have a backlog at the end like last week. There are so many questions at the end and we just couldn't answer all of them. So start asking your questions now. Today's topic is on gastrointestinal cancers and how to keep the gut healthy with Datuk Dr. Yunus Gul from Prince Court Medical Center. So hi, Datuk Dr. Yunus.
Hello, Maisie. Good evening. Nice to see you again, Maisie.
It is good seeing you, Dato. So I think I'll just jump straight to the questions. For those of you who have questions, just bear with me. This is more of the questions that I had, and I'm sure you have your own. So please put them on now. Just put your questions in, and we'll try to pick them up at the end of the session. So, Dr. Yunus, I'm just going to ask you, I'm going to jump straight to the questions. So, what are the different gastrointestinal cancers out there?
As you mentioned earlier, Maisie, if we were to start from the top, the types of cancers that we do see affecting the gastrointestinal tract includes the esophagus, which in common terms also known as the gullet, and then going down to your stomach, and then the small intestine, which is uncommon, cancers of the small intestine, and of course then your colon and the rectum. Now these are so-called hollow organs involving the gut directly from the top going right down to the bottom. And we also must not forget
Hello? Dato? Hello? Do you guys hear him or is it just me? Hello, Datuk. Do you hear me?
Can you hear me, Maisie? I can hear you.
Yeah, okay. Sorry, you were cut off for a while. Maybe you can continue now.
All right. The just back to, from the esophagus right down to the anal canal, you can have cancers involving any of the intestinal tract. And we must also not forget the solid organs that you mentioned early on, such as the liver and also the pancreas. So this would be the type of cancers that you will see involving the gastrointestinal tract.
Okay. Datuk, could you speak a bit louder because Gary says that you're a bit soft. They can hardly hear you.
Can you hear me better now?
I can hear you better. So if you still cannot hear, please mention it. Tell us, all right? So I'll ask the second question. What would be a good age to start screening?
From a screening perspective, it depends primarily on the symptoms, Maisie, and also the organ or the site involved. I'll give you an example. If we start from the top, if we are talking about the esophagus, if a patient presents complaining of difficulty in swallowing, you would suspect that there may be an issue or a problem with the esophagus. And you will then investigate the patient based on the symptoms that they have. Similarly, with the stomach, if a patient has what we term as dyspeptic symptoms, or Malaysians call it gastric type of symptoms, you would think that it would be a good idea to ask further questions and then also investigate the stomach. Uh, with regards to the colon and the rectum, there is a screening or what we call surveillance measures that we undertake because of the increasing or increased incidence that we've seen amongst our population developing colorectal cancer. So at the moment, the recommended age for screening patients with colorectal cancer is 50 years of age, though we have begun to recommend patients having these screening measures at an earlier age, such as 45 years old. But before that age, if patients do have any symptoms such as an alteration in their bowel habit or passing blood per rectum or even mucus per rectum, we will then advise the patients to have screening measures performed.
I see. Okay, so we still follow the age of 45 and above for colorectal, and the rest is for the rest of the symptoms for the other gastrointestinal cancers is to listen to our bodies.
The reason why the other cancers, cancers of the esophagus and stomach, we've seen a reduction of these type of cancers, Maisie. Stomach cancers used to be very common, and it was related more to socioeconomic factors.
I
But
see.
with improved kind of standard of living, and also if we were to look at the causative factors for stomach cancer, for example, we talk about preserved foods, such as
Mm.
what you see in the Japanese population, where stomach cancer was extremely common. You talked about preserved, salted foods, the nitrosamines that are produced, which are carcinogenic, causing an increased incidence of gastric cancer. With refrigeration and less use of preserved kind of foods, we have seen a reduction in stomach cancer. And also, let's not forget about Helicobacter, the bacteria which is found in the stomach, which is also carcinogenic. Since we've discovered this bacteria, and now we know that there is effective treatment for eradicating this bacteria, that has also seen a reduction in the incidence of gastric cancer. Similarly, so with esophageal cancer, uh, we only advise patients who have reflux symptoms, Maisie, and patients who have severe reflux who've had an endoscopy and where we have found a change in the lining of the lower esophagus. We term it as Barrett's esophagus. That's a precancerous change in the lower esophagus. Once we discover that, then we will advise the patients to have routine surveillance endoscopies to make sure that the Barrett's doesn't change to what we call an adenocarcinoma or invasive cancer.
I see. Okay. Thanks for sharing the screening ages. Now, my next question is, how do we take care of our gut or possibly prevent gastrointestinal cancers?
The What I mentioned to you earlier on plays a very important role. Maybe remember what I said about stomach cancer, food, preservatives.
Yeah.
We There definitely is a link between the environment, the food that we eat, apart from genetic factors that can cause gastrointestinal malignancies. So I always do mention to my patients that the food is our medicine and the food is our poison as well. So I think one of the most important things is to take care of our gut and the types of food that we eat. I think if we were to concentrate mainly on freshly prepared foods,
Mhm.
trying to avoid preservatives, trying to avoid barbecued kind of meals, grilled meals,
Let
makes
me
a
see.
difference in terms of promoting a healthier gut and also avoiding the development of cancer. And there's also a link between obesity and cancer as well, Maisie. Apart from that, consumption of red meat is something that we would normally tell patients to try and avoid and increase kind of healthy, wholesome foods, including cereals, grains. So that's what we would normally recommend to our patients or the public.
So you would say that food plays a very important role in keeping our gut healthy.
Absolutely, Maisie. It makes a huge difference. Apart from the food, exercising and keeping your weight in check makes a huge difference as well, Maisie.
Okay, that's very good to hear. I always advocate this, so I hope all of you take note of this, especially from a gastrointestinal specialist.
And
So,
Maisie, if I can add as well, Maisie. Remember,
yes,
we spoke about the gastrointestinal cancers, colorectal
yeah,
cancer being a common cancer. We've seen a reduction in gastric esophageal cancers, but liver cancers is a good example. I mean, liver cancers you develop usually from patients who have liver damage or what we call cirrhosis that can lead towards cancer formation. And one of the more commoner causes of liver damage and cirrhosis that we see, even in this part of the world or in our country, Maisie, is associated with fatty infiltration, your so-called fatty livers that
fatty
we see quite
livers.
commonly in screening patients, and that's all related to food, obesity, diabetes, which are all lifestyle-related factors, Maisie.
Okay. I think this is more. I think Dato is mentioning this for most of the other diseases that diet plays a huge role. So I hope all of you take note of this. And Dato, what are the symptoms for cancers of the gut? Are they all similar, or they are different?
The the symptoms, Maisie, if we start from the top for esophageal cancers, I mentioned difficulty in swallowing. The term is
Mm,
also called dysphagia, uh, and
dysphagia.
also painful swallowing as well. Those are symptoms of concern. Now, if the symptoms were only short term, Maisie, let's say if you only develop it for a day or two and then it disappears, then of course it's not of concern. But if it persists, let's say for 2 weeks or more, then you would say that, look, there is something wrong and that needs to be investigated. For patients with stomach symptoms or gastric symptoms, those who have persistent pain in the upper part of the stomach, pain after eating, for example, weight loss. And if you were to do your blood test, you find that your blood count is on the low side. It means that you may have a tumor which you are bleeding from. And that would instigate further measures to evaluate to the patients in terms of performing, let's say, an endoscopy to see if the patient has got a gastric cancer. For patients with pancreatic cancers, they usually present late, unfortunately, Maisie, and
Mm,
that's something that's quite unavoidable at this stage. For patients with colorectal cancers, the symptoms that we mentioned early on is an alteration in their bowel habit, either constipation or diarrhea that's persistent. Anything more than 2 weeks is of concern. Rectal bleeding, Maisie, I just want to emphasize that the majority of people, the public, and even some general practitioners or some doctors would think that when a young patient presents with rectal bleeding, it's almost always due to hemorrhoids. And they are right in most of the instances, but you can get it wrong sometimes. So, because rectal cancer and even the left side of the colon can cause rectal bleeding as well. So, any persistent symptoms, it's always a good idea to get this evaluated to ensure that the patient hasn't got a malignancy or a cancer that's causing the symptoms.
So the most important is that if you have any of these symptoms, get yourself checked rather than not listening to any of these symptoms and waiting until the very last minute before you actually go to see a doctor.
Absolutely. And Maisie, coming back to the liver, for example, as well, if you have
Yeah.
been diagnosed with hepatitis B or hepatitis C, or also with fatty liver disease that's caused an impairment in the liver function or cirrhosis, make sure that there is adequate or regular follow up with your doctor or with the specialist, because these conditions, when it's diagnosed early, can be treated. I mean, you remember there are vaccination programs for hepatitis B, and there are medications now for patients who have a liver disease or liver cirrhosis that can actually reduce the viral load for patients with hepatitis B and hepatitis C. And if treated effectively, of course, that will prevent the patients from going on to develop liver cancer. Because unfortunately, we are still seeing patients presenting with late stage liver cancer. And this is similar to colorectal cancer as well. The majority of patients that we see are those presenting with stage 3 and stage 4 disease. So we are still lagging behind with the more developed countries such as the US, whereby they're seeing patients presenting a little bit earlier because of the surveillance programs that they have there. But we are playing catch up. We're getting there, but we still need to be kind of on our toes to make sure that the patient and the public are well informed of the symptoms and also the importance of surveillance and screening.
Okay, thanks, Dato. I think I would like to echo your thoughts that surveillance monitoring is very important, and that's why we're having these type of sessions so that everyone gets educated, so that people are aware. And I think it's very important that all of you try actually share this video now, get people to come in, ask questions, and be educated about our gastrointestinal tract in general and how to keep it healthy. So you may start asking your questions now, everyone. Start putting them in. I have about 3 more questions before Datuk Yunus takes on the questions from all of you. So my next question, Datuk, is in terms of surgery to remove the tumor, will that be first line of treatment, or it can like vary depending on the stage?
Maisie, whenever a patient presents with cancer, the main focus or the gold standard treatment or management is to remove the cancer. So surgery will be the top and first and foremost measure that you will consider in treating the patient, because if you think about it, you have a cancer there that you want to remove, and the most effective way is surgery or excising it. Now, unfortunately, some patients do present at a stage whereby the tumor is advanced. And for those kind of patients, if you were to operate on them straight away, you may not be able to remove the tumor completely. But fortunately, we do have measures to try and downstage or to reduce the size of the tumor, either in the form of chemotherapy for most of the gastrointestinal tumors, the esophagus, the stomach, the colon, and the rectum. These are tumors that are sensitive to chemotherapy. So these tumors can actually reduce in size prior to surgery if they do present at an advanced stage. And for tumors of the rectum, radiotherapy is effective as well, and also for the esophagus in downstaging the tumor to a remarkable size, and even in some cases, treat it completely so that patients may not require surgery.
All right. Okay, thanks for actually letting us know about that. It's good for all of us to actually know what are the treatment options available out and how to go about it. And in a way, what to expect for those who are first diagnosed with colorectal cancer or any gastrointestinal cancers.
Yeah,
So,
and
how are, sorry?
maybe the other important issue is that when you are diagnosed with a cancer, it's always a good idea, apart from seeing the surgeon, is to get an opinion from an oncologist as well, so that they both speak the same language and they work in tandem to help treat the condition, so that you get a clearer picture in terms of what is the best way to tackle the particular cancer.
All right. So if you find out you have cancer, you should work with a surgeon. I mean, you should see a surgeon and also an oncologist.
Yeah, if
Um,
it's an early tumor, an early cancer, then of course the surgeon plays the main role in managing the cancer, and then following that they will refer the patient to an oncologist.
to
But if
onco.
the patient presents a little bit later or with a very large tumor or a tumor that spread to the other organs, then it's a good idea to get an opinion from both the surgeon and from the oncologist.
All right, noted on that. The next question is, how are the various gastrointestinal cancers diagnosed? For example, stomach cancer.
The diagnosis, the endoscopy still plays a major role, Maisie. So putting an
Okay.
endoscope helps you visualize the tumor, the location. It may not give you the stage of the tumor because for that you will need further scanning. But obtaining a biopsy to see what type of tumor you're dealing with makes a difference as well. Then, following the endoscopy, once a diagnosis is made, you will then progress to do either a CT scan or an MRI scan or a PET scan to further stage the cancer. And then you will get a clearer picture in terms of how best to treat the patient. So the endoscopy still plays a major role. And apart from the normal endoscopy, you also have measures of such as endoscopic ultrasound, which can image the lymph nodes around the particular gastrointestinal system, such as the stomach, the pancreas, and also obtain cells to be sent to the lab for analysis to see if there are any malignant cells or any spread to nearby lymph nodes.
Okay. I think it's very important. I think for all of you watching right now that it's don't be afraid of endoscopies or colonoscopies. If it's advised, we would like to encourage you to actually go for it. I mean, I personally, because if it wasn't for a colonoscopy, I wouldn't have been able to detect that I had a tumor in my rectum. So as you all know, I'm a colorectal cancer survivor, and I know of people who have bowel issues, but they keep saying that they don't want to go for a scope, even though it is advised by their doctors. So don't be afraid. It's not a difficult procedure at all.
Maybe you're
Um,
absolutely right in saying that
yeah,
because I mean there are patients who are still afraid in this day and age of having an endoscopy, and I think they tend to forget that the procedure is mainly done or performed under sedation, so you don't feel a pain or discomfort, and in the experience
yeah.
usually you will forget after the procedure as well. I think the most challenging issues with performing a colonoscopy, for example, is actually taking the bowel preparation to cleanse the bowel.
Yes.
And once you have a clean bowel, it actually becomes quite simple following that.
For me, that's the most painful process.
Yeah.
But maybe for those of you who it's your first time, it's nothing. I would think so. And last but not least, my last question is, and for those of you who have questions, please put it in now because this is my last question. What would your advice be to maintain a healthy gut?
The Maisie, I mean, most importantly, I mean, try and eat home cooked food. I hope I'm not doing a bad publicity for all the food delivery companies and those who are marketing their products out
Oh
there.
no.
But but I think we're living in a different kind of our lifestyle environment in terms of both husband and wife working, and coming home late, and the ability to prepare food, of course, is always a challenge, isn't it? But even if you were to get food from outside, think healthy, think fresh produce, think fruits, think vegetables. Try and reduce the consumption of red meat and processed food. I think if we can do that with regular exercises as well, Maisie, and preventing this problem that we are facing now of obesity, and or tackling that at an early stage. I'm talking about childhood age, Maisie. If you were to go to the schools nowadays, especially our national schools, you will see that quite a high percentage of the kids have got to that obese stage, and we need to prevent it or tackle it at a very early stage. So that would be my main kind of advice to all your listeners and to the public out there.
All right. Thanks a lot, Datuk, for your advice to everyone out there. Now, if you don't mind, like I said, to all the audience who are watching now, it's very hard to get Datuk's time. So this would be the best time to ask questions. I think we have a few questions so far. So, Datuk, I'll take the first question first. Patrina asks, is soft stool also under diarrhea category? Does it also count on the number of times one pass motion? Thank you.
That's a good question, Maisie. I think what's more important, apart from the consistency, is the frequency of bowel motions, Maisie, and also your pattern. I mean, if there are
Mm,
patients who open their bowels 3 times a day, there are patients who open their bowels once every 2 or 3 days, and the consistency may change depending on what you're eating. And I think when we talk about an alteration in the bowel habit, is that when you get a change in your usual pattern that persists, let's say for more than 2 weeks, then you start, getting a little bit concerned. So, say for example, if you're opening your bowels once or twice a day, and then suddenly you find that you're going to the toilet 4 or 5 times a day with kind of more liquid stool, and you find that it's a little bit more difficult to completely evacuate your stool, so you may find a little bit of mucus there. That means there has been an alteration. The consistency of the stool usually depends very much on what you have eaten and your dietary patterns as
mm,
well. So if you have soft stools and you only open your bowels once or twice a day, you may not worry about that too much. But if you open your bowels once a day and then suddenly you get to a point whereby you're going to the toilet 4 or 5 times a day with soft stools, then you may get a little bit concerned about that.
mm. Yeah, I agree. Like how I found out was also because I kept having diarrhea or soft stools. So the next question is from Mrs. Bharti Mehta. She says she has no control of bowel movements after surgery because she removed the rectum. So do you have any advice for her? I,
The the
yeah,
yeah, I mean, unfortunately, I mean, there are patients. It's a price that sometimes you pay depending on the location of the tumor. So tumors that lie low in the rectum, we have no options but to remove the majority or all of the rectum. And normally, when the bowel is joined together, we join it very close to the anal canal. So maybe if you were to envisage the rectum as a reservoir, the function
yeah,
of the
I
rectum
know.
is to store the stool, and so that when you get an urge, you evacuate your bowels. So once that reservoir is gone, and you replace it with another smaller caliber bowel, such as the colon or even the small intestine, that changes is going to affect you. So you will go to the toilet more often. But very rarely do we get patients having incontinence issues, Maisie, because the sphincters are
Mm,
usually preserved. And
yeah.
there is a modality whereby we would advise patients on dietary measures to help with the bowel function and control. So patients who've had cancers, uh, uh, especially colorectal cancers, once they've been diagnosed and they've had, let's say, part of the bowel removed, they always think healthy. So they think that eating more fruits and vegetables
Fiber,
definitely
exactly.
going to help. So they take more fiber. And sometimes when you do take more fiber, you will have more of so-called your increased bowel frequency. And that might not be helpful for that patient. So I think dietary measures and speaking to your surgeon and the doctor who operated on you will make a major difference in helping you to improve your symptoms. But diet plays a major role.
I completely agree because I actually added a lot more meat, protein in general into my diet, and that has helped a lot. When I know of the foods or fruits that would cause me to have gas. So I'm one of those patients that most of my rectum is removed. So I completely understand, and I completely agree that controlling. I mean, our diet plays a huge role in how frequent the movement of the bowel is. So, okay, the next question is from Natalie. She says, does stress lead to constant gastric?
Absolutely, it can, because you have so-called this patient's type A personality and who are always on the go. And we're living in a more stressful day and age as well at the moment, with all the increasing pressures that we face. So that does produce a higher acidity in your stomach, Maisie, and you can develop gastric related issues or symptoms. And what we normally find in these patients when we do an endoscopy is that we find that the patients do have gastritis. Fortunately,
Mm,
it can be treated with medications, but the stress or the stressors is something that the patients will need to try and modify. That is something that we would advise the patients as well to try and avoid it. But unfortunately, in terms of work related or education related stresses, they are something that persists or can go on in life. But it's up to the individual to try and fine tune that or modify that, which I can assure you is doable. As long as you put your mind to it, Maisie, you can do anything. And I think what the individuals need is sometimes someone to talk to, either professional or non-professional. Also join a group, and I think meditation helps as well for those patients who are highly stressed, and exercise, sports. I
mm,
think there are other
yeah.
activities that help to keep your mind away from work-related measures. Unfortunately, nowadays we are focusing more on social media, the internet, and we spend a lot of time in front of the screens, not only the internet, but also Netflix, movies, and not doing enough exercises, Maisie. I think
Mm.
if these kind of patients spend more time doing external or outdoor activities and keeping themselves active, I think you can keep your mind pretty much in tune with a fine, balanced life.
I agree. Exercise and diet plays a huge role. Keep your body weight healthy, guys. And I mean, that also helps reduce stress. So when I'm really stressed out, or rather before I start the day, I need to work out. So to just make sure that my day goes as hopefully as planned, because I am quite a stressed out person before this, but now not so much. I agree with Datuk. So, Datuk, we have quite a few questions. So, I'm just going to jump straight to the next question. Wisha asks, what types of vitamins or supplements are recommended for rectal cancer during chemotherapy?
There are so many vitamins available out there, Maisie, and I wish I had a picture to show you. I had a patient who was 76 years old, and he came to see him in the clinic recently, and he told me he took a few supplements, but I didn't believe him because I did a blood test. I do an annual blood test screening for him, and I found that his liver function was impaired, which he never had before. So I told his wife, I said, please bring in all the supplements that he's taking. And without any exaggeration, Maisie, he was taking 60 bottles of different supplements that he's been buying over the internet, basically. These are direct purchases or direct sales. So that had caused an impairment in his liver function.
Wow.
So let's not overdo things. I think if you were to take a healthy, balanced diet, most of the nutrients are in what we eat, Maisie. Uh,
Mm,
the vitamins that I normally advise my patients are those who've had radiation treatment, for example. Vitamin E and vitamin C do help in patients who've had radiation in terms of helping the cells to regenerate and to avoid any damage following radiation treatment, Maisie. Apart from that,
okay.
a dose of vitamin C may not go wrong either, but never overdo it, Maisie.
Okay, so not 60 pills. Please
Absolutely.
always speak to your doctors first before you consume more than 5 pills, I would assume, or even
Absolutely.
5 pills may be too much. Okay, so Eileen asked another question. She would like to know if colonoscopies should be a routine examination for all of us, as some of us may not be that observant of the symptoms.
Uh, the present guidelines do state that for those for the public even 50 years and above, it's recommended that you undergo at least a colonoscopy, Maisie. Even though I would recommend it a little bit earlier nowadays, 45 years of age, I would say that have a colonoscopy done, unless you've had a first degree relative who's had cancer diagnosed. For those who've had a first degree relative who had a colorectal cancer diagnosed before the age of 60, then you should have it at least 10 years earlier, say, for example, at the age of 40, or even before that, to ensure that there is proper surveillance. So at least a once-off colonoscopy 50 years at 50 years is recommended. Uh,
All
there are
right.
new screening tools, Maisie, for those who are completely against having a colonoscopy or don't want an invasive test, such as a virtual colonoscopy using imaging, such as a CT scan, and even a DNA stool-based test, which are not, of course, as
Mm,
sensitive yet, but they are available. But the gold standard for the present moment is still an endoscopy or a colonoscopy.
I see. There's also the FOBT stool test, right?
Yes, the
Okay.
FOBT stool test is good to diagnose patients who may have occult bleeding from the GI tract, which is associated with patients who have cancers or large polyps. And there is a modality which you can perform. And I think we're seeing more of that being performed in this part of the world as well.
Okay. I'll tell you guys a little bit more about this towards the end. Uh, but the next question is, Madam Yo asks, is weight loss usually one of the first signs of cancer?
Weight loss may be the first symptom that the patient may present with. And of course, any patients presenting with weight loss, you would kind of the alarm bells may start ringing, but you need to ask the patients whereby they have a change in their diet, any stresses or stressors induce weight loss that are possible, and then of course the investigations will set in, Maisie. So if you have unexplained weight loss, that is a symptom of concern, and you should see a doctor to have it further evaluated.
Okay. I hope all of you took note of that. I like this question from Eric. He asks, if we eat 2 or 3 times a day, does it mean we also need to excrete 2 to 3 times a day? I like that
No,
question.
that's not necessary. It depends on the see the bowel movement of each individual is different. There are patients or public who only open their bowel once a day, once every 2 days, once every 3 days. There are even those who evacuate their bowel once every 4 days. There are some who go 3 times a day, and that's been normal for them since early kind of teenage years or early childhood. So each individual is different, and it also depends on what you eat as well. But so it doesn't mean that you eat 3 times a day, you are going to open your bowels 3 times a day. And apart from that, apart from the bowel movement per se, it also depends on what you eat. There are certain foods that increases bowel transit time, and there are other foods that slows down transit time. So, say for example, if you were to take fiber on a regular basis, fruits and vegetables is a good example. That will increase the transit time, so you may go to the toilet more often, especially if it's mixed with an adequate amount of fluid intake. Maisie, uh,
Mm,
just as a note to all your listeners, some think that taking a lot of fiber helps, but if you overdo taking too much fiber and not enough liquids, what's going to happen is that it's gonna clog your system down, and you may have issues with bloating and even constipation. So
mm,
don't think that taking too much fiber is going to be helpful. And remember, in life, too much of anything is bad for you. So
that's
it's
true.
important
Let's keep to the moderate diet.
to have it balanced. And on the contrary, if you were to take red meat, for example, or too much red meat, that slows down the transit time, and you may have constipation or difficulty in opening your bowels. So that is the other reason why we recommend that you reduce the red meat consumption, Maisie, because
Okay.
if you reduce the transit time, and if there are any toxins in your gut, you're increasing the contact time between the toxins and the gut lining, and that will increase the probability of you damaging the gut lining, and then of course developing cancers in the future.
Hmm. Okay, that's too much of anything is not good for us. So keep a
Absolutely.
balanced diet. Risha asks, what if there's a lot of constipation and the rectum seems to narrow? Then is a rectal stent necessary, or is there any other way to avoid it?
Uh, we need to ask Visha. I mean, usually the rectum narrows, Maisie. There would be a reason why the rectum has narrowed.
I see.
Has the rectum narrowed due to a malignant or cancer-related issue, or is it due to a benign condition, which is not uncommon because the rectum capacity is quite large. It's about 1 centimeter square.
Hello, Dato. Hello, can you hear me? You're a bit
I can hear
laggy.
you, Maisie.
Okay.
Can you hear me, Maisie?
Yeah. Yeah, now I can hear you. I
Good.
think it's raining
So
in your area, right?
yeah, it is. For Visha's
Okay.
question, I think the important thing is the what is the cause of the rectal narrowing, Maisie? Can we find
Rectal
out? So
cancer, she says.
if it's due to rectal cancer, remember what I said. The most important treatment
I see.
is surgery.
Diet.
But before surgery, you would want to treat you try and downstage the tumor. So you would want to remove the tumor
Hello, Dato. Can you hear me? Yeah, yeah, lagging again. Can you guys
the
hear him, or is it my Wi-Fi?
the weather here is not great. I must admit. But
Okay.
can you hear me now?
Yeah. So
Yeah.
okay. So the most
So for
important part is surgery, right?
so if you want to downstage the tumor before giving the patient radiation or chemotherapy, the patient may need an insertion of a stent to
Hmm.
open up the narrowing, Maisie, so that
Okay.
the patient can evacuate their bowels effectively. So
I
a
see.
stent may be needed for those patients, but it's only for lesions that are lying high in the rectum, Maisie, because you cannot put a stent low in the rectum because if you were to do that, it's going to cause a lot of discomfort, and the stent may get displaced. You may extrude the
Hmm.
stent.
Okay.
So it
I
is
hope that answered your question, Risha. So, Datuk, I will take two more questions. One is from Adrian and one is from Mashur. Okay, she asks, do we need to seek a dietitian's help consistently, especially after surgery, since it seems that food plays a huge role in maintaining our health pre or post surgery?
yes, Maisie. You do need to get assistance from a dietitian. But also very important, Maisie, is that I think if you were to keep a note or a diary of the food that you take and what symptoms you develop on that particular day, after a few weeks, you'll be able to tell what food causes you symptoms that are either disabling or something that you can't tolerate. And you will be able to then exclude this kind of diet from your regular meals to help improve your symptoms. So, apart from getting help from a dietitian, it's not a bad idea to have a food diary,
Mm,
Maisie. Because
I
remember,
agree.
I mean, not everyone is the same. Some individuals react differently to different types of foods. So it's very difficult for a particular dietitian to give you advice solely based on how your gut works.
That's true. I keep a food
But
diary for
remember,
almost a year.
you are in control the majority of times following surgery pertaining to the food that you take.
Yes. I agree. It's very important for us to keep a food diary, especially after surgery. Like for me, I kept it for about more than a year, thanks to Datuk's advice. Okay, I think there's just two more questions because
No problem.
the last question from Eric is quite I would like to know as well. So Adrian asks, is there an organic way we can complete detox and clean up our gut? As we understand, many kinds of diseases starts from our gut. Or what is your recommendation?
Okay, Maisie, I'll give you a very simple analogy, right? Okay. The gut works very similar to how you produce waste at home, right? So the rubbish collectors, they come to your housing area quite regularly, I presume. You
Yes.
just don't extrude or remove your rubbish either once a week or once a month or once a year. You do it quite
Yes.
regularly, right? So
Yes.
as soon as one rubbish pack or plastic bag is removed, another one is produced quite soon after that. That's similar with your gut as well. So it's very difficult to completely detoxify the gut because as soon as you remove whatever contents that you have in the gut by flushing things out, because you get a lot of recommendations based on what your friends are telling you, or your relatives are telling you, or also on the internet, in terms of detoxifying your gut by drinking solutions or even having enemas. There's even been things such as coffee enemas recommended. But as soon as you do that, within hours, your gut is contaminated again by fecal contents because you can't stop eating, you can't stop drinking, so you will produce waste. So it doesn't make sense to completely detoxify your gut, Maisie, because it's going to be replaced by waste again very soon. That's number one. Number two is that you also run the risk of removing good bacteria from your gut.
Mm.
Remember, our gut is colonized by healthy bacteria that's been living there for years, that is helping to protect your gut from the so called bad bacteria. So you don't want to be removing that either. And so you have to be very careful in using these so-called modalities of detoxifying your gut, Maisie, because I certainly don't believe it works. I think the important thing is that if you were to take a healthy, balanced diet and open your bowels regularly, whereby you don't feel uncomfortable, you don't feel bloated, you don't have constipation issues, you do not need to detoxify your gut or or try and cleanse your gut. Do it the natural way.
Mm. I think it's true as well. In terms of coffee edema and all these type of detox, I think it's best that we try to open our bowels on a daily basis rather than do a detoxification, which we will also put back garbage in our gut after right after that.
Absolutely.
um, yeah. I think the last question is from Eric. What is your opinion of a transnasal endoscopy? Is it available at Prince Court Medical Center?
Transnasal endoscopy is something that's meant to be a little bit more pleasant, Maisie. It is not available at Prince Court because the normal endoscopy works just as well, Maisie. The reason why I'm saying that is because don't forget, we perform endoscopies with the patient under sedation so that we can perform it in a patient in a restful state, whereby we can evaluate the gut in its entirety without any disturbance and get a proper visualization. Now, of course, uh, when new techniques or technologies come into the fore, it's always advertised and promoted as being something that's absolutely brilliant. If you are thinking of having the procedure done without sedation, just under local anesthetic, then of course I think the transnasal endoscopy will be something that you can consider. But if you're going to have the patient sedated, then the normal endoscopy, the transoral endoscopy, is usually the best because you get very nice, clear visualization in performing such procedures, Maisie. And if you were to do biopsies or anything more invasive, you can do it all in the same sitting.
All right. Thanks a lot, Datuk, for answering all of the questions. I'm sorry if I missed any of your questions out. Thank you so much, Datuk, for spending your Sunday afternoon with us and for answering all everyone's questions. Really, really appreciate it.
Maisie, no problems. It's always a pleasure having you, uh, firing all the questions and me trying to help out as much as possible, and also educating the public as well, Maisie. You're truly an inspiration, And the other issue is that if there are any of your listeners who have asked or who would like to ask further questions, just don't hesitate to send me an email, and if I can help in any way, I certainly will do so in any way that I can, assist.
All right, thank you so much, Datuk Yunus, from Prince Court Medical Center, and for actually opening the option for them to email you. I think they would probably email you. So thank you so
No
much.
problem. No
And
problem. No problem.
for those of you who are wondering, the National Cancer Society Malaysia is having an FOBT stool test ongoing now. So just use the promo code CMS NCSM112 to get it at 12 ringgit. So just get your gut checked if you have any issues, or it's just if you want to support NCSM, please do so. Other than that, thank you once again, Datuk Yunus. Thank you, Prince Court. And we have next episode. We have the final colorectal cancer awareness series. So please join us next week. We really hope to see you. And please share this video out with all your friends and family. I think it would really, really benefit them. Thank you so much, everyone.
Thank you,
Bye.
Maisie. Take care. Bye bye.
Thanks, Datuk. Bye.